Today, I want to address a question that millions of Indian adults type into search engines every single day. Can diabetics smoke? Let's start with the clinical answer, which is unambiguous. Ask any endocrinologist or general practitioner, and they will tell you. Smoking worsens blood sugar control. It accelerates every major diabetic complication. It raises mortality in diabetics by 55%. Major guidelines like the American Diabetes Association and the 2024 KDIGO Chronic Kidney Disease Guidelines are unanimous. Cessation is not optional, it is a standard of care. But there is a massive gap between what the guidelines say and what patients actually hear. In a rigorous clinical trial in Kerala, 52% of diabetic smokers attending specialist clinics had never been advised to quit smoking by their doctor. They didn't even associate smoking with their diabetes complications. Why does this happen? The reality of the Indian healthcare system is complicated. Consultation times are incredibly short, often just 5 to 15 minutes. Doctors are busy adjusting medications and checking blood pressure. Sometimes there's an assumed futility, a belief that smokers won't quit even if told, or simply a lack of a clear referral pathway for counseling. The challenge, this is not a willpower problem. This brings us to the most honest part of this conversation. This is where most health articles stop and where most patients feel unseen. The doctor says, quit. But for a person who has tried and failed, quit is a destination without a map. Nicotine dependence is a physiological condition. It alters brain chemistry and creates very real withdrawal symptoms. Between 60 and 86% of Indian tobacco users have moderate to high nicotine dependence. For you, cessation requires clinical support. It is not a failure of willpower or character. So if you are not ready to set a quit date today, the conversation isn't over. It just shifts to what can we do right now. That is exactly where Smoke Safer Gold fits in. Smoke Safer Gold is an advanced 5-stage cigarette filter utilizing activated carbon. In independent lab testing, it demonstrated a 70% reduction in tar, a 71% reduction in carbon monoxide, a 47% reduction in nicotine, and a 75% reduction in average carbon yields. It is a considered, evidence-backed step for those not ready to stop entirely. Hi, I'm a co-founder of Smoke Safer. We understand that many adult smokers aren't ready to quit overnight. They seek a practical solution that fits into their daily routine. That's why we created Smoke Safer. Compact, reusable filter accessories utilizing advanced layered filtration and activated carbon technology to help reduce harshness. We're here to offer a thoughtful alternative. The bottom line is this. Every diabetic smoker deserves personalized, structured cessation support. Structured counseling actually increases your odds of quitting by 8.4 times compared to brief advice alone. But if you have been failed by a busy system that hasn't made space for this conversation, it's not your fault. It just means you might need to initiate it yourself. Talk to your doctor today. Ask for a plan. And until you are ready for that final step, Smoke Safer is here to help you manage your everyday routine. Thank you for listening.